Hello and welcome to my presentation on my dissertation. The title is Walking the Line, Boundaries and the Therapeutic Relationship in Walk and Talk Therapy. My name is Alice. I chose this topic because in my previous life as a teacher, walking outside sort of saved my mental health, and it also made me very interested in the effect that not being outside very often was having on my students in terms of their own mental health. So that's what started me on the journey of being interested in the psychological effects of being outdoors. So first thing is introducing the concept of walk and talk therapy and our study. So in terms of what walk and talk therapy is, it is simply conducting therapy in an outdoor environment. So doing exactly what you would do ordinarily in a therapy room, but outside whilst walking. There is, and people will know about this, lots of evidence for benefits of being outdoors and walking. Lots of evidence for sort of positive psychological effects of being outdoors, for example, gardening, how walking can help alleviate depression, how being outside does create those, does sort of lower stress and increase well-being. And there is evidence for the practice of walk and talk therapy specifically having benefits. So, for example, previous studies by Clark, Prince-Llewelyn and McCarthy, Dickmeyer et al. Showed reductions in stress, increased well-being, and showed that walk and talk therapy has a comparable effect to traditional therapy. Participants in those studies who had experienced receiving walk and talk therapy also reported feelings of freedom, a reduced formality in comparison to traditional therapy, and a perception of a more balanced power dynamic, which is obviously really, really exciting. However, because of that sort of reduced that increased freedom, the reduced formality, and that balance, some researchers and sort of prospective clients for walk and talk therapy did have expressed concerns about boundaries. So if there is this feeling of freedom, if we're outside going for a walk, will it just feel like going for a walk with a friend? How will we keep it like therapy? And so that is what we wanted to study in this piece of work. So there is no specific research on how therapists perceive the therapeutic relationship in contrast with the therapeutic relationship in traditional therapy, in the context of walk and talk therapy. And there's not specific research on asking therapists how they manage boundaries and create a sort of professional therapeutic relationship in the context of walk and talk therapy. And also, crucially, there are not existing guidelines on how you should conduct walk and talk therapy. So we felt to address this gap, asking therapists about their perception of the therapeutic relationship and how boundaries are managed could give us some insight into best practice in this sort of new emerging field of therapy. And we felt that could be useful when guidelines are being drawn up or for training in the future. So just asking people who are already conducting walk and talk therapy how they maintain those good boundaries and make it feel like a counselling relationship rather than just a friendship. Okay. So we'll go on to the method, how we conducted the study. So first and foremost, it was ethically approved by Bangor University Ethics Committee and involved no deception or anything that would be sort of majorly controversial. We conducted a qualitative study using semi-structured interviews which lasted approximately 45 minutes, and we conducted 4 interviews. Participants had to be currently practicing qualified therapists with at least 1 year of experience of walk and talk therapy and traditional therapy. We made sure that they were seeing at least one client, had regular supervision, and were suitably qualified, just for sort of ethical reasons. And also because we wanted them to have the necessary experience to speak about the topic. In the end, we mainly recruited through word of mouth. And so our initial recruitment email had a link to an online questionnaire, which was on-site toolkit. And this was a basic questionnaire to check qualifications. And if a questionnaire was filled out, as well as them sort of filling out the consent form, we followed up with an email to arrange a more sort of detailed interview. After the interviews, they were transcribed and were subjected to a thematic analysis. Okay, next thing is the results. So these were in the form of key themes that we found from our interviews. So our first key theme is the positive impact of conducting therapy outside. This was a sort of common theme between all 4 of our interviewees, where they mentioned that being outside had a positive impact as a whole on the therapeutic relationship, but also on the effectiveness of therapy, and obviously those things kind of fit in together. Therapists commented that they felt relational depth was much deeper because they were able to have deeper conversations as a result of being outside. So things that they saw outside, so for example, butterflies, the landscape, meant that they could have sort of deeper conversations, and meant that conversation flowed more easily. So, for example, one therapist discussed how they were able to use a sort of ancient castle as a metaphor for somebody's sort of legacy in life, and how you as a person change over time but still remain there. So she described it providing a very interesting sort of topic of conversation that maybe would not be present inside the therapy room. They also commented on how in walk and talk therapy, it created they were able to create a relationship with nature for the client that perhaps could result in a more sustained effects of therapy. We're able to be outside, and so we are able to sort of connect with nature, and that could give clients the skills and the tools to be able to manage their own mental health better by having this relationship with nature and being able to go outside. And also, and I think that's really interesting. So you can see that in this. You can see that in this quote here. So obviously the idea that the relationship with a therapist is not permanent, but you're creating a more permanent relationship with nature so they can bring those skills into their everyday life. Another key theme was therapists commenting on how walk and talk therapy may be particularly suitable for particular client groups. So they mentioned that the lack of eye contact required, because you're walking side by side and not necessarily looking at each other, might make it more suitable for those who find eye contact quite stressful. So for example, some people who identify as neurodivergent or might find eye contact quite stressful in certain situations, so walking next to each other may sort of work better for them. And also they said that certain clients might really struggle to sit in a room and not having and sort of might struggle with a sort of clinical atmosphere. So for example, younger clients, so being able to sort of move around and having that freedom to move and the less clinical environment perhaps would make walk and talk therapy more suitable for them. and it's sort of less intense, less clinical, and they feel more relaxed and more able to form a better bond with their therapist. The next theme is the sort of differences in power dynamics, which feeds into the sort of therapeutic relationship, that central relationship. So therapists told us that they were more likely to sort of self-disclose, but in a sort of appropriate way. So they said they were more likely to be asked by clients about, so for example, oh, your name, what does it mean? Or and they were also more likely to sort of disclose things about themselves, but they stressed that this was in a sort of very appropriate way and in a way that was actually helpful for therapy and helped create that bond, because there's more things to talk about and more sort of or more ways to talk about yourself, and more, but in a good way that helps with creating that rapport. And also increased chances for collaboration. So, for example, a client could use the landscape as an opportunity to sort of not talk about something they didn't want to do. So they might sort of try and distract by sort of saying, "Oh, what about what's that bird, or what's that plant?" If they, in a sort of it's a non-confrontational way to not discuss certain things that you're not ready to discuss, and gives that client more more control over the situation. They're also able to say, "Oh, can we have a little rest here?" Or things like that. So that, or they maybe are able to suggest the route and things like that. So there are more opportunities for a client to feel empowered and in control of that session. And as one of the therapists said in this quote, the relational depth is stronger because you haven't got that Freudian power dynamic. And I think that is really significant for the kind of work you may be able to do in walk and talk therapy, where you have this balanced, egalitarian and a very empowered relationship. The last key theme is really about how the practical way that therapists said they managed boundaries. So, obviously it's lovely if we've got this quite deep relationship, if we are creating really good relationship with our client, but we've got to manage boundaries. So how do we do that? How do we make this feel like a professional counselling relationship as well as having that lovely deep relationship? So they all talked about awareness of safety, so making sure they are safe and the client is safe, and so things like, are they wearing suitable clothing? Does someone know where I am? Does someone know where they are? Does somebody know where the client is? Do they have a mobile phone? And that sort of safety aspect. They also talked about the importance of having an explicit conversation about confidentiality. There are obviously more chances for somebody else to sort of walk past you or hear what you're saying. So they all talked about how they need an explicit conversation around, if we meet someone what do we do? How do we keep this confidential? What do you want me to do? Do you want me to ignore them? Do you want to say something? Do you want me to talk? Like, what happens? So it's all about explicit and clear conversations before walk and talk therapy starts, and that is also reflected in. They all spoke about contracting, how it's different in walk and talk therapy, because it's a bit more straightforward and sort of one size fits all perhaps in a therapy room, but when you're outdoors and working with clients, there's a lot more things to consider. So, for example, do they find particular locations triggering? One therapist spoke about that, about checking, about that kind of thing, making sure they understand the sort of nature of the relationship, and that is how they all said they managed the perhaps more informal setting. And I think that is a really important takeaway, which I'll discuss later. Okay, so the last little bit is kind of the interpretation or the discussing of these findings. So in terms of sort of theoretical implications, I think a really interesting theoretical implication is as nature as a third entity in that therapeutic relationship. It's almost like the therapist is facilitating a relationship for the client with nature that they can then take away. And I think we can then perhaps think about how perhaps in a walk and talk therapy, is that relationship with nature that you've creating a more sustained effect? So are we giving them more tools and strategies for keeping their well-being elevated past the point of therapy ending? Does it create a more sort of sustained effect? And does contextual memory play a part? So you are able to go back to the place you had that therapy, and that would perhaps aid your memory for what you discussed in that therapy session. And I think that's a really interesting idea. One of the therapists also mentioned the idea that the movement itself is perhaps triggering certain parts of the brain, perhaps slightly in keeping with sort of in the EMDR. And I thought that was a really, really interesting idea about perhaps that movement is helpful in itself and perhaps could be the source of more discussion or more research in the future. I think also the idea of nature as a point of connection between the therapist and the client is really interesting. So it helps you create that initial point of connection. We both like nature, let's go out for a walk together, and let's go out together is very interesting. The idea that nature can be used as a metaphor and to create that sort of that conversational flow and depth, and perhaps allow clients to share more and convey more to therapists is really interesting. And the idea that being outdoors in an outdoor setting, in a more neutral setting, for in terms of the therapist is not in control, creates that balanced power dynamic, and could that have an effect on that relational depth and therefore create better effects for therapy, because we know that the therapeutic relationship has a massive effect on how effective therapy is. It's basically the biggest deciding factor in how effective therapy is. I think in terms of sort of practical therapists, or indeed the sort of takeaway message from this presentation for therapists, is perhaps the suitability for neurodiverse clients. It helps or neurodiverse, or those others who find traditional therapy too clinical for whatever reason. It's a good, if you're a therapist, this could be something to recommend to clients. It might be something that's quite suitable for some people. And also, I think the take-home message of what is required for you as a practitioner in terms of safety and sort of necessary preparation, and the idea that clear contracting is key. That is how you're going to manage those boundaries within this setting. It's clear initial contracting, and then ongoing assessment about, is this suitable? Is this still suitable for this client? In terms of future directions, I think there's some really interesting questions about, like I was describing earlier, are the effects of walk and talk therapy sustained over time? Do we have an effect over time? Can we go back to clients and they've still got that increased well-being later? Does contextual memory play a part? Does that make a difference in how effective the therapy is? More detailed things about contracting, what specifically is important. I think that would be really helpful for future guidelines and future training. What's actually really important to include specifically, and do particular client groups, such as people with people who are neurodiverse, young people, do they have better outcomes from walk and talk therapy? And perhaps why is that? Is it to do with increased relational depth and the capacity for creating better relationships within walk and talk therapy? Okay, so here are my references. You can perhaps pause the video here to have a look at those. These are the main ones that I have referenced. And lastly, thank you so much for listening. Here is my email address, and I really hope you are as excited as me about some of the things that we found and for the future direction of walk and talk therapy. Thank you so much.